Thank you very much and good afternoon. So today we're reporting our weekend numbers. So the first reporting period from Friday to Saturday, we had 647 additional COVID-19 cases in British Columbia. From Saturday to Sunday, 726 cases were diagnosed, and from Sunday to today, an additional 647 people were diagnosed with COVID-19. That brings our total for the last 3 days to 2,020 new cases, 10 of whom were epidemiologically linked, bringing our total in British Columbia to 38,152 people who've been diagnosed with COVID-19. That includes 304 people in the Vancouver Coastal Health Region, 1,362 people in the Fraser Health Region, 45 people in Vancouver Island Health Region, 203 people in the Interior Health Region, and 106 people in the Northern Health Region. We now have 9,380 active cases in the province in all health authorities, of whom 349 people are in hospital, 77 of whom are in critical care or ICU. We have 10,747 people under active public health monitoring, again, in all areas of the province, and 27,287 people have recovered from COVID-19. Over this past 3 days, we've had 35 people who have died from COVID-19, bringing the total number of people in British Columbia who've died from COVID-19 to 527. This, of course, brings sadness to us all. And my condolences go out to the families, to the care providers and communities of these people who've passed away over the last 3 days. We know how challenging, how hard it is to lose somebody during this time of year, and particularly during this time of COVID. We have 6 new healthcare facility outbreaks in a variety of places around the province, including the Bradley Centre, Chilliwack Lifestyles, Crofton Manor, Lakeshore Care Centre, McKinney Place, and Village by the Station in Interior Health. In addition, outbreaks have been declared over at the Hawthorne Seniors Care Community, Lakeview Care Centre, Sunset Manor, Valley Haven Care Home, and Ridge Meadows Hospital. That leaves us with 57 active outbreaks in long-term care and assisted living and 8 in acute care units. There are now 1,697 active cases in long-term care, 1,073 residents, and 605 staff. Additionally, we've had 1 new community outbreak at a mink farm in the Fraser Health Region, and of course we are paying very close attention to this outbreak. In other parts of the world, particularly most recently in Denmark, and prior to that in the Netherlands, and as well in the US, we've seen outbreaks on animal farms such as this, particularly mink farms, where there has been transmission from humans to mink and back, and where we've seen some mutations of virus in some parts of the world. So it is of great concern for us, and we are working closely with WorkSafe BC to ensure that all of the measures on the farm are being done appropriately, and also with the Ministry of Agriculture, our animal health colleagues, to make sure that the animal security and health is maintained as well. And this is, of course, an important measure that we need to look at holistically, and we're involved with both the CFIA and the Public Health Agency of Canada to make sure that all of the appropriate measures are taken on this farm and the other farms here in British Columbia. That includes very strict controls under the Animal Health Act here in BC for who and what can come or leave on the farm. Today as well, we have some very good news about an upcoming vaccine that we can all take some heart in, as we all do our part now, knowing that the availability of vaccine to protect those people who are most at risk is actually just days away now. Next week, we expect to receive our first delivery here in BC of the Pfizer vaccine, as you heard announced federally this morning. It will be a start of a program, a very important start, but just a small amount to start with to ensure that we get our logistics going, but our ability to start protecting elders and seniors, particularly in our care homes, and the healthcare workers who care for them, will be an important step forward in our COVID-19 struggle. And later this week, Dr. Ross Brown and myself and the Premier and Minister Dix will be providing a full briefing to everybody on the vaccines themselves and our approach and our team and how we're going to be managing this very complex and challenging initiative, but make sure that we have an adaptable and flexible plan so that we can get vaccines as efficiently as possible to everybody who wants them here in British Columbia. All right, I'm going to start today. While we can all celebrate this encouraging news about vaccines, we can't lose sight of the fact that we continue to have very high levels of transmission and community spread here in British Columbia. And hundreds of people, as you know, remain in hospital, and as we've seen this weekend alone, tragically, far too many people in BC have died from this virus, and many more are at risk right now. I want to share a couple of slides to provide an update on where we are and how we are progressing. What this one shows is by health authority region, the cases that we're having, so the number of people diagnosed with COVID-19 per million population. And this is, this is something that helps us understand how we're progressing over time. The rate of increase, as you can see, has been steep across the province, but most pronounced in the Fraser Health and Vancouver Health region. And very recently, particularly in the last few days, we have starting to see a leveling off. This shows that what we are doing, the measures we have put in place, are starting to have an effect and starting to work. This means that what you are doing every day is making a difference. But we are not yet through this storm, and we cannot let up now. All around us, in every community, the virus continues to circulate, and we are seeing increasing rates in our interior and in the north in particular. We only need to look as well to our adjoining provinces and states to recognize that we are in a very challenging time. Across Canada and across the world, particularly in the Northern Hemisphere, we are seeing that this virus can transmit very easily and that our risk is very high, despite the measures that we have all taken to try and reduce risk. The other information I'll show you here is our case counts, what we call our 7-day average. And that is a measure that helps us smooth things out over time. And the green line at the top is our numbers of cases per day in a 7-day rolling average. So we report them every day, but it levels out those peaks and valleys that have to do with when tests are completed. What you'll also see here is that our hospitalizations, although lagging the case numbers, as we know, by several weeks, are now peaking. And we need to continue to take the measures that we've been taking to ensure that that also levels off. And as we're starting to see, the blue line on the bottom is ICU and critical care. And that, again, is a very important measure. What this tells us is that the hundreds of people that are in hospitals across the province right now are receiving the care they need in a safe way, but it is straining our system. As you know, the orders that we've had in place have been to reduce our in-person social interactions as much as possible, because we know that this virus transmits, particularly now at this time of year, and particularly when we're in close contact inside, and it transmits to those people we are closest with. As well, we want to limit our social interactions to those essential activities in our lives, like work and school and other essential services. Non-essential social interactions, so things outside of work and school, where we had some leeway in the summer when we had lower rates and lower transmission, we now need to pull back from and that any of those interactions should be done in a very safe, low-risk manner, such as small numbers and outside. In addition, we've put in targeted measures to deal with specific higher risk activities that we've seen transmission happen, and those conditions that lead to transmission, including being inside, being in crowded places, having poor ventilation, etc. Today, I am now issuing the following orders, which are in effect immediately. I'm extending my published gatherings and events order of December 4th with respect to the controls and restrictions on people visiting other people in their residence to midnight of January 8th, 2021. Of course, we will continue the allowances that we have in place for people who are living alone to have one or two other visitors. I am also extending my published order of December 4th with respect to prohibiting all gatherings and events as defined in the order to midnight of January 8th, 2021. This means that all those events that we have been talking about for the past few weeks continue to be prohibited, with the exceptions as they are listed in the order. However, one addition, I am now accepting from the order drive-through and drive-in to drop off and leave events. So where we know that in some occasions we have either drive-through to look at lights where people do not get out of their cars, or to drop off, and at this time of the year we've seen things like toy drives and others. As well, we are accepting drive-in and stay events to a maximum of 50 cars, in which people must stay in their cars, and people attending these events should be only your household, and the exceptions must continue to maintain physical distancing, having entry and exit controls, and ensuring that there's no congregation or congestion, and people remain in their cars for the duration of the event. As a reminder, the other parts of the gatherings and events order that do not expire remain in effect for the foreseeable future, and that is the restrictions on adult team sports, indoor and outdoor, and the group fitness restrictions. Some of these may begin to operate once we've issued the further orders and guidelines about how to do these safely in the new context that we are living in right now. As we have published last week, child and youth sport can continue with limited activities with specific restrictions, and of course no travel for any teams in the province. As well, work-safe safety requirements that we outlined in the past weeks must continue, and these include reviewing and updating of COVID-19 safety plans in all workplaces, daily health checks, and encouragement that whenever feasible, workers work from home. And I mentioned 2 weeks ago that we are actively working with WorkSafe BC and pulling together, particularly in the Lower Mainland, teams to enhance our inspections in these areas and to make sure that appropriate safety measures are put in place. And we are bringing some more leadership to that team, and we'll be talking about that later this week, just to say that this is an important focus right now, and each business needs to revise and review their COVID safety plans to make sure that all of the measures that are needed now, given the context we are in now. I understand that for many of us, this will mean celebrating the coming important holidays in a different and smaller way than what we may be used to. We can, though, still be festive. We can still connect with family and with friends in a safe and virtual way in many cases, and we have seen so many ways that people have done this in the past months, and we will need to continue to follow these guidance. As hard as this may be, let's remember that the sacrifices we make now will protect our loved ones and countless others throughout the province, and will keep our strained healthcare system open and functioning for all of us. We just need to look at the data I presented today to see the evidence that our efforts and our sacrifices are making a difference, and we can't let that go now. particularly when we know that things like vaccines are so close and that we will save lives by taking these measures and by staying small and staying local over the next few weeks, and will help ease the pressure as we go into the year ahead. We cannot afford to have a rebound and have increased numbers of people being sick and ending up in hospital in the next few weeks. We need to hold the line and continue to bend our curve. And I want to thank all of you out there throughout the province who are continuing to do your part, because it is making a difference. We need to continue to use all our COVID safety strategies. Staying small saves lives. Staying close to home saves lives. And these are our family, our friends, our community, our lives that we are saving. Now, more than ever, we must stick to this, and we must support each other and be caring to each other and be kind to each other, be calm and be safe.